the integrated home safety check. It's a reassurance, I suppose, and a steer to assist us to let us know that we're on the right lines, really. You know, a lot of what we're doing in developing new ways of delivering services to the communities is breaking new ground, and there's no real benchmarking opportunities to talk to other partners about, and so it's a great opportunity that our peers and people in other agencies are taking a look at what we're doing and the judging panel and consider it to be the right direction. The work that we're doing and convincing other partners to engage with us in the work that we're delivering sometimes is met by barriers or opposition. The fact that now we can call these projects and this particular project the award-winning integrated home safety check will assist us in breaking down some of those barriers and working more collaboratively with other partners. There's an old saying, if at first you don't succeed, try and try again, because if I'd have accepted, or if our team had accepted no at the first time of asking on every occasion, then we wouldn't have made the progress that we've made. So I would definitely encourage people to not accept no on the first occasion and continue to try to convince partners of the importance and the benefits of working collaboratively. The high point of the integrated home safety check is seeing people who have a variety of different needs being addressed at the same time without the need to wait for referral or wait for another partner to make another appointment, to have the ability for our staff who are across the threshold of 20,000 homes in North Wales to deliver a service where people can be signposted or they can have the service then and there. North Wales Fire and Rescue Service is a learning organisation, and we continuously invest in the development of our staff, and that's for reasons to both improve their ability to deliver service but also to continually improve the service that we deliver to the public. So we really do prize continuous improvement as a tool towards providing that better service delivery, which is more effective and more efficient for the communities that we serve. I think that the high point for the prevent and respond team and the realisation that we were on the right track was when we went round the country visiting different services up and down both England and Wales. And lots of services talk about the success of their particular projects, and so have lots of media coverage and so on. And the really important thing, or the benefit that I could see, was after those visits a realisation that we weren't far behind, and in fact in some ways we were leading the way. We were far more advanced in some of the thinking and some of the particular projects that we were doing, and actually the areas which have been lauded as being the best areas in the country were coming to us and asking us to keep them informed of our projects, and that was the high point for me. North Wales Police, North Wales Fire and Rescue Service and Welsh Ambulance Service Trust took a bit of a gamble when they invested in a project which was conceptual at the time, ideas in which we could be more efficient, more effective and break new ground. And this was at a time of shrinking budgets and in a context of austerity and burdens of high volume, low priority calls for service mounting up for both police and ambulance service. And so the benefit of this award, or the positives from this award, is that it gives recognition that that was the right thing to do at the right time to invest in this work, which is now proving to be successful, and we're moving towards a positive state of it becoming business as usual.
For the team, it's recognition of all the work that they've done in the last couple of years. You know, we've had some bumpy times, there's been some difficulties, but actually we've come through it the other end. So for us, it just gives us positive reaffirmation that this is the way we're going as an organisation. It's got, you know, sign up from all of the people who work in the health board, but actually it's the way we're going to do our business going forward. This is what we want an Arfer and Bevan Health Board to look like. So what I would say to anybody who is thinking of any sort of improvement work is don't give up. It's hard to put your head above the parapet sometimes, but it's definitely worth it. The benefits are absolutely phenomenal, so don't give up and just do it. From a service user perspective, they may not necessarily know about ABCI, but actually what they'll see is the end result through the service, because our reason for being there is actually to improve the patient journey. This is about changing the way we do things. It's not about static, staying the same way as we've always worked. So the service users might not know about us, but the service they get at the end of it will be better because of it. I think the fact that our executive team and our health board invested in something like ABCI at a time of complete financial difficulty says it all. I think it just says to people, this is the way that we're going to do business in an Iron Bevan from now on. And I think that there's a real sense that we don't just do our own job, we do our job to improve our job as well. And that's the way it's going to be in ABUHB.